Let's talk about molar pregnancy on ultrasound. Let's define what a molar pregnancy is. A molar pregnancy forms when you conceive, but instead of a baby growing in the uterus, you grow a tumor or a mass in the uterine cavity. And sometimes these mass, we might be able to see some embryo or some maybe placental tissue within the mass, but sometimes it's just a mass that forms in the uterine cavity. And what happens is, when you conceive, sometimes you'll start seeing bleeding that comes and stops, looks like fresh blood. And then it becomes more when you go towards the 3-month, 3rd month, and 4th month, and 5th month. The bleeding becomes more and more. And most of this time, you'll go to the hospital to see exactly what's happening. Once you go to the hospital, they do a pregnancy test, and it's going to be positive. And they'll tell you to do a scan just to see what is happening in the uterus. Once we do the scan, we'll just see a mass or a growth in the uterine cavity, in the endometrial cavity. And this mass, we're going to have a granular appearance. It's going to be vascularized. It means it will have blood flow. It will be a complex mass in the uterine cavity or in the endometrial cavity. And we are sharing this information not because we want to share to spread fear, but just to share information. Because some of these things, if they are found earlier, then there's medication, there's treatment. So once we communicate to the doctors that there is a molar pregnancy, that what we are having is not a normal pregnancy, but it's a molar pregnancy, then I'm sure that they are going to help you get a solution, and you're going to be well. I would like to talk about this information because molar pregnancy can be dangerous, because sometimes, in some cases, a molar pregnancy can turn out to be cancer of the uterus. So once you see bleeding or once you are pregnant, always make a point of doing a scan so that at least some of these things can be ruled out. If they're there, you can receive medication, you can receive treatment, so that at least you can go back to your normal life. And once you receive this information, it's always good to share, because some of this information could save a life. And thank you always for tuning in, and thank you always for even commenting. And I've always prayed that even if you get that you have a molar pregnancy or you have some of these issues, our prayer has always been that God is going to watch over you. God is going to heal you. Even as we do our part, we have always believed that healing comes from our God. Thank you for always tuning in, and have a great day ahead.